be able to access therapy, definitely recommend checking them out and telling others about them. I'm always surprised at how few people know about Open Path. I didn't even know about it before I started in private practice, so I really want to boost them. Um, and then, if you have people who are like, I'm on a million wait lists, it's just not happening. Phone and text therapy can sometimes be more affordable than traditional therapy and might be a good option if you're, really needing services and you might be on a wait list for another low cost therapy option. So how to find a therapist if you do have insurance. It can also be difficult, even when you have health insurance. And I am so sympathetic to that as someone who gets health insurance through the exchanges, and it's always a mess every year. The easiest way to do this is just to call your insurance and ask them to send you a list of in-network providers. And also ask them what, if anything, your copay will be, what you'll have to pay out of pocket per session. Always good to do this in advance so that you can know for sure that whoever you end up going with is in network with your insurance, and also no surprises when it comes to what that copay is going to be. Then I recommend kind of browsing the therapists on that list by looking them up in a directory like Inclusive Therapists or Psychology Today. Or you could look in that directory for therapists that specialize in the treatment concerns that you are wanting to seek therapy for, and then cross-reference that list with your list from your insurance so you know for sure that that is up to date and they're definitely in network with your insurance. Then I'd recommend kind of narrowing it down to maybe 3 therapists that you think, based on their profiles, might be a good fit, and call these therapists, confirm they're taking new clients, because that can change pretty quickly, especially this time of year, and make sure they take your insurance. Most therapists, pretty much every therapist should offer a free consultation to prospective clients, for you to ask questions, kind of get a feel for their personality. And then if you're feeling good about it, you can schedule an appointment with that therapist once you feel like you have one that you want to try an initial session with. So that is kind of an overview of the process. I like to start there because I know saying, "Oh, I should get a therapist," is one thing, and then the logistics of actually doing it can be really overwhelming for a lot of people. So here's again a little starter pack guide. Okay, so if you have a therapist, what does that look like? That's the whole topic of the session. So I want to hear just real quick from everyone, if a couple folks want to chime in, what you picture when you picture therapy. What have you seen on TV or in movies? Just let me know. We'll hear from one or two people, preferably folks maybe that maybe haven't been to therapy before, or maybe what you thought therapy was like before you started.
Looking in the chat, it looks like almost all of us have mental health experience or are providers. But yeah, the other person who started talking, you go.
Yeah, I was gonna say I'm a therapy goer myself, but prior to that, I remember like feeling super super anxious because I just picture like facing somebody and like making direct eye contact and being super vulnerable and like having to open up really quickly. And now I having experienced it, I know that it's like a very like relationship building, and you don't just have to immediately jump into like the hard stuff. But yeah, I always picture like a very cozy therapy office.
Yeah.
Can I also add real quick? I don't know if anyone else has experienced this in their story, but like feeling like you could mess it up, like do it wrong because you're also talking to someone and this is a relationship that you're half of. Thought I might throw that out there.
Yeah, thanks. I really, really appreciate y'all chiming in. And yeah, I definitely had the same fears and nerves before starting therapy, and I am a therapist. So I think that part of it is pretty universal. Yeah, I think a lot of the media representation for therapy, it's definitely getting better. But I think is, you know, a lot of that, it looks really intense, maybe very dramatic. A lot of times I think people picture still, you know, sitting on a couch facing away from someone while they take notes about you, that kind of old school Freudian type of therapy, which I think was, you know, like the New Yorker cartoon version of therapy. So really what I want to talk about in this presentation is that how therapy can look really different depending on the therapist and depending on the therapeutic modality that they tend to use. First, let's define some vocabulary. A therapeutic modality is just a framework for doing therapy. It usually involves just kind of an overarching theory of human behavior and emotion, and then also some techniques for healing. Um, so sometimes finding the right therapeutic modality or combination of modalities and the right therapist can take a couple of tries. And what part of what I want to normalize here is, you know, if you started with a therapist and maybe you just felt like it wasn't clicking or it wasn't for you, but you still feel like you could benefit from therapy, you know, I hope you give it another shot. And maybe this presentation will give some ideas of other ways that therapy can look that might be a better fit. Okay, so there's a couple different types of therapeutic modalities, and I like to start here because this, you know, usually people are maybe wanting some different things out of therapy. So maybe they want to learn strategies to cope with something really stressful that's going on in their life. That would kind of direct them to certain skills-based modalities, right? Skills-based modalities really focus on teaching coping strategies. And usually that type of therapy is very focused on what is happening in the present tense, what is currently going on in the client's life. So some examples are CBT and DBT. We will get into those examples in more specifics later. Just for now, enjoy the acronyms. There's so many beautiful acronyms in therapy. Okay, experiential modalities. These would be maybe for folks that are really wanting to unpack past events. Maybe they've had traumatic experiences in the past. Maybe they've had experiences that they don't really know how to fully understand or define, but they feel really stuck there. So experiential modalities tend to fall into this category of trauma processing modalities. And some examples are EMDR, IFS, and somatic experiencing. Um, then there's analytic therapy. The main example of this is psychoanalysis. This type of therapy modality is really focused on the relationship between the therapist and the client. And it's really about gaining insight into your relationships and dynamics and the experiences that might have led to those relationships and dynamics. So these are really broad categories. Most therapists use some combination of each of these types of modalities with their clients. So I know personally, I was trained in CBT, cognitive behavioral therapy. I use a lot of that. And I also do EMDR and IFS. I don't do psychoanalysis, but I know some really nice folks that do. So we'll start going through some of these examples of different therapeutic modalities. Um, we'll start with cognitive behavioral therapy, which if you've heard of any therapeutic modalities, you've probably heard of this one. It's a skills-based modality, and it's based on the idea that thinking negatively is a habit and that habit can change. So CBT really looks at your the situations you're in, the thoughts that you have, the emotions that come up, and then the behaviors that those thoughts and emotions produce. Really looking at how all of those pieces interact with each other, and then you look for points of intervention, right? So, for example, if you notice that you have a specific negative thought that keeps coming up whenever you know, go to the grocery store, for example, and that really affects your mood, right, when you go, and then maybe it's leading to avoiding going to the grocery store altogether, right? Then you're out of food. Um, then you would say, okay, how can we maybe change that negative thought pattern to then change that mood that's resulting from it, and then eventually change that behavior? So some examples of skills that you would learn in cognitive behavioral therapy might be cognitive restructuring. This actually went viral as like a Twitter meme a little while ago, which I thought was so funny, but it was basically like, here's how to restructure your thoughts so you're not depressed anymore. It was really good. But yeah, it's basically that. It's basically trying to look at the evidence for and against a negative thought process, and then coming to a more balanced thought that might be less based on insecurities and fears and more based on what is actually happening and the information you have available. Um, and another example of a skill might be spotting a cognitive distortion. So basically looking for irrational thought patterns. Um, CBT can be really helpful for treating depression and anxiety. I also find it's a really good modality for folks that maybe are going to therapy for the first time and don't really yet have a vocabulary around talking about their thoughts and emotions and internal life. So I use this a lot, especially with kids and teenagers and adults too, who just haven't really had the occasion to express themselves in that way yet. Okay, DBT. Um, DBT stands for dialectical behavior therapy. It's a mouthful. This is why we use the acronyms. It basically teaches 4 core skills. So mindfulness, acceptance and distress tolerance, emotion regulation, and interpersonal effectiveness. Dialectical is just a fancy word that means opposites. And it comes from kind of combining the 2 ideas of change and acceptance, right? And it can be really helpful for treating depression, bipolar disorder, borderline personality disorder. It was developed by Marsha Linehan, who had a lived experience with mental health. So it's really based out of her experiences and what she found helpful in her life. Okay. EMDR might be another one that you've heard of. Or I heard someone tell me the other day that they were doing EMDR on Grey's Anatomy. Which sounds like something they would do on Grey's Anatomy. Okay, this is an experiential modality. It stands for eye movement desensitization and reprocessing, and we'll get into what each one of those words mean. Um, but it is basically a treatment designed to alleviate distress associated with traumatic memories. And it uses something called bilateral stimulation, which just means anything that is activating both sides of your brain. To help clients stay grounded in the present while they are doing the memory reprocessing. So instead of experiencing a flashback where they might feel like they are reliving that traumatic experience, the bilateral stimulation allows them to stay grounded in the present while still, being able to remember without re-experiencing. And EMDR also focuses on changing the negative beliefs that were internalized from those experiences and traumatic memories. So eye movement, desensitization, that's basically decreasing the distress associated with that memory. And then reprocessing refers to changing those negative beliefs. That's EMDR. Okay. This is one you may not have heard of before. It's less kind of buzzy, probably has not been on Grey's Anatomy, unfortunately. IFS stands for Internal Family Systems Therapy. It was developed by someone named Richard Schwartz, who is a therapist. And it basically views strong mood states and patterns of behavior as parts of self rather than the whole self. So when you're doing IFS, you might work with a therapist to understand why those parts of self are showing up in the way that they are, uh, based on the circumstances that those parts of self developed in. So you might ask, okay, when did this, really strong mood state, or when did this pattern of behavior first start to show up in my life, and what was going on at that time, and how is that maybe different than what's going on now? And the goal with IFS is really to come from a place of self-leadership and self-compassion, to give those parts that might be stuck in past experiences an update, bring them into the present, and maybe work with them so that they can find different ways to show up that are more aligned with the circumstances you're in now. Um, so the three goals of IFS are freeing parts from their extreme roles, right? Restoring trust in the self, and then finding coordination and harmony between self and parts. I love IFS. I use this modality all the time. I think it is really fantastic for trauma processing. I think it can be really helpful too if folks maybe were who heard about EMDR, maybe saw it on Grey's Anatomy and were like, that looks really scary. I need to process my trauma, but I don't want to do that because EMDR can look pretty intense. IFS, I think, is a really gentle way to get into trauma processing, where maybe you don't have to look directly at a memory itself to process the impact of it. So I really love this modality. Just want to shout it out. I have to, you know, verbalize my biases here. Okay, another experiential modality that's really good for trauma processing is somatic experiencing. Um, this is a body-centered approach that helps people heal from trauma. And it really focuses on what are the body's natural responses to trauma, what physiologically happens when you experience trauma, rather than necessarily focusing on the thoughts and emotions associated with it. And it really aims to modify the body stress response by working through those sensations that might still be stuck in the body from a traumatic experience. So it can help release stress from the body, regulate your nervous system, and also be able to, confront and experience painful memories without kind of shutting down completely. So yeah, it's really awesome. And there are a lot of health practitioners that come from a somatic lens and work with some of the techniques of somatic experiencing that aren't therapists. I know there's a lot of yoga teachers that get trained in somatic experiencing too. And I love that mind body crossover. Okay. We'll end with psychoanalysis. So if you've heard of Freud, this was his deal. Um, This psychoanalysis basically explores the unconscious mind to help people understand themselves and their relationships and relieve psychological distress. So it is based on this idea that our past experiences shape our present, and that painful feelings can kind of stick with us unconsciously and influence our behavior and mood, even if we're not completely aware of it. Um, I did want to highlight a really good idea within this modality that I think can help people understand like what it is instead of just, what people think Freud looks like and kind of the cartoon version of this. But transference is this idea that, feelings about one person can be transferred to another. And typically in psychoanalytic therapy, um, the focus is on what feelings toward individuals in that client's life is that client maybe transferring on to the therapist, and how is that coloring interactions with the therapist and kind of the progression of therapy itself. So it can be really interesting to explore that. And definitely I know some folks that have gotten a lot of benefit from psychoanalysis. Okay. Um, this, last slide, I really wanted to highlight maybe a thought process that some people might have when they're considering therapy, and really just put forward some questions to ask if you're on the fence, this idea of how do I know if I'm ready for therapy? I kind of, maybe take issue with the idea of being ready for therapy because generally I think therapy can be beneficial for a lot of people, and sometimes you have to take the leap, and there might be a period of time at the beginning where you are doing that goal setting and figuring out what you want to get out of the experience, collaborating with the treatment provider, especially if it's your first time in therapy. But generally, I think it's good to ask yourself, am I open to talking about my personal experiences with someone new? Because that is the scariest part of therapy, right? Is opening up to who is a total stranger, someone who's a total stranger. I think it's also good to Ask yourself if you're open to your perspective being challenged. I think part of therapy inevitably is the therapist maybe providing a different lens through which to look at your own experiences. Sometimes that can feel challenging or surprising or uncomfortable. And I think, quote unquote, being ready for therapy sometimes involves, both being able to say, nah, I don't think that's right if you don't agree with the therapist, but also being open to considering a different perspective. And then another question might be, do I have the capacity to try new skills, right? Do I have the time and the energy to maybe try a different way of approaching some of the stressors that are going on in my life? Big one just logistically, is, can I commit to showing up for at least 1 hour, at least every other week? I think therapy at its core is about, intention, right? And 1 hour a week isn't gonna change your whole life, but if you set the intention for what all the other hours of your week are going to look like within that hour, then that hour really can have an impact, right? But you need to dedicate at least that amount of time to it to really see the benefit. Um, and then I think it's good before you start therapy to think about what your goals are for healing and mental wellness. Basically, what do you want to be different after you have gone through the process of therapy? Um, so those are some good questions to just keep in mind to percolate on if you're on the fence about therapy. Maybe questions to ask friends and family who might be on the fence too. All right, I want to open it up to questions, and I know we have another person here to talk as well about. We have Adam here to talk about lived